All right, thank you for joining today's event entitled Skilled Nursing Facility Certification and Recertification, Understanding Medical Review Findings and Avoiding Denial. My name is Mary Sue Gardner, and I'm a registered nurse on the Provider Outreach and Education team, and I am going to be your facilitator for today's event. I'm also joined today by other members of Provider Outreach and Education, as well as Medical Review, who are going to be helping me with today's call and manning the Q&A section or the chat section of our call. A few housekeeping items before we get started. We have a training center at the top of our website, on the top of the website, wpsgha.com. And in that training center page, you're going to find all things such as live events, training materials like our slide deck, upcoming education, encores, which are recording of live events that you can watch outside of YouTube. Those encore presentations are generally on our encore page for about 60 to 90 days, so on our encore page of wpsgha.com. But you can always find them on our YouTube page until the information is either changed or updated. If you have questions during today's event, place those questions in the chat and send them to all panelists. And my associates are back there in the background and right there willing to help with those questions. If we have an opportunity, we will answer those questions live during the Q&A portion of today's call. Finally, if you have any feedback on today's experience, there's going to be opportunity during and after the event to take the survey. Jennifer's going to go ahead and place a link to our feedback survey in the chat right now, and she's also going to place it in the chat at the end of the presentation. So if you're listening to this event as an encore, we encourage you to also take the survey. The encore survey link should be at the top left of the screen, and there's going to be a little eye with a circle around it, but it will also be available at the end of the presentation for the encore and also in the description of the encore. For the live event, again, we've placed it in the survey now in case you find you need to log off early, so you can go ahead and take that feedback survey for us. And this is everything I just covered. On your screen now is our disclaimer, and our disclaimer basically says we created this as a tool to assist you, our provider community, with the skilled nursing facility certifications, laws, rules, and regulations as they stand today. But if those laws, rules, or regulations happen to change tomorrow, it's your responsibility as a provider of Medicare services to make sure you're following the rules that are in effect on the day of service that you are providing them. So we're going to provide any answers to questions today based on the laws, rules, and regulations as they are in effect today. But I also want to say that CMS also has final determination on any kind of rulemaking. Acronyms. Medicare's full of acronyms, and there are a lot of acronyms that are used in skilled nursing facilities as well. So these are the most common acronyms that I will use in this presentation, or I may refer to in the presentation. So if I happen to say one of these things and you don't know what it means, just refer back to this page. Or if I throw out another acronym and you don't know what it is, just put it in the chat and one of my associates will help you identify what that is. All right, the meat of today, my objective and the agenda. My overall objective today is that you learn how payment for covered post-hospital extended care services may be affected if a physician does not make the required certification and any necessary recertifications, as well as ensuring those certs and recerts are timely so that there's no lapse in coverage. So we're going to accomplish this today by reviewing the coverage criteria. We're also going to be discussing review findings, and we're going to be looking at some live documentation examples. So we're going to start today by reviewing the Medicare regulations and coverage criteria on certifications and recertifications for skilled nursing facility services. Let's start by reviewing where these coverage criteria come from and where you can find that information. We're going to cover what the information means on the next upcoming slides. But the Medicare General Information, Eligibility, and Entitlement Manual, which is publication 100-01, section 40, or chapter 4, section 40 of this manual is all things physician certification and recertification. It ranges from hospitals and home health and hospice, outpatient therapy, and skilled nursing facility like we're discussing today. So you can find the regulations specific to skilled nursing facility under section 40 of that manual of chapter 4. The next link on this page is going to take you to the benefit policy manual. And that information is under chapter 8. It's also section 40. So this manual is just specific to skilled nursing facility PPS services. So you can find information on cert research under section 40 of that manual as well. If you have the slide deck, these are automatically going to link you to those regulations. So let's talk about these actual regulations and what this means. First, it is the skilled nursing facility's responsibility to obtain and maintain the certs and recerts for extended care services. You, as a skilled nursing facility, get to determine the manner in which you obtain it and the manner in which you maintain it. Medicare does not require any specific form or layout. Some facilities choose to keep a similar type certification form, which you can find if you just do a quick Google search for skilled nursing facility certification form. There'll be a plethora of them that come up. Again, these forms are not required, but some have been developed and are really good and help you as the provider community ensure that you're capturing the things that need to be captured. And we will talk about those things as we move on in this presentation as well. So keep in mind, as I mentioned before, it is the SNF's responsibility to obtain and maintain the certification and recertifications. But if you as a facility failed to obtain it and it's not due to medical necessity, but rather the physician's refusal to sign, maybe because they feel that the beneficiary does not meet the medical necessity criteria or those requirements for a Part A skilled nursing facility stay, then you cannot bill the program. You cannot bill Medicare for those services if you choose to provide them. And you can also not bill the beneficiary if services are not medically reasonable and necessary. In all other instances, if the physician's refusal to sign is based on something like he doesn't like your facility, or the physician doesn't, didn't want the patient to go to that facility, but it's medically reasonable and necessary for them to go to a skilled nursing facility, then that would not fall under that criteria. So it's only if the physician refuses to sign based on they don't believe it's medically reasonable and necessary that you can't bill the program and you can't bill the Benny. All right. let's now talk about who can sign the certification and recertifications for Medicare stay. I'm going to refer back to the very first line of the Medicare General Information Eligibility and Entitlement Manual, that Chapter 4, Section 40. It says in that manual, payment for covered post-hospital extended care services may be made only if a physician makes the required certification, and where services are furnished over a period of time, they're required recertification regarding the services furnished. And that does include the physician extender or non-physician practitioners. That section of the manual also goes on to specify a certification or recertification must be signed by the attending physician or a physician on staff of the skilled nursing facility who has knowledge of the case, or the physician extender, that is a nurse practitioner, a clinical nurse specialist, or a physician assistant. And those extenders, or like your PAs and your NP, those people have to have direct knowledge of the case, but they not have a direct employment relationship with the facility. So that means those people need to be working in collaboration with the physician. So the easiest way to think about it is, who does the MPP's paycheck come from? If it comes from the facility, then that person can't sign your certification and recertification. If their paycheck comes from the physician's office, then they can. All right. So moving on, we talked a bit about the requirement of having a cert and recerts and who can sign them, but what exactly is the certification? What does it really mean? A certification is really an indication that the stay in a skilled nursing facility and the receiving cares that are going to be made, you know, and paid for by Medicare Part A is indeed medically reasonable and necessary for this patient on this day. So the physician or MPP is really attesting to the fact that the Benny needs to come to the skilled nursing facility to continue to receive services for a condition that caused the hospitalization in the first place, or they continue to need skilled nursing facility services for a condition that arose in the SNF for treatment of that ongoing condition. The initial certification is a little bit different than recertification. The initial is affirming that this beneficiary on this day needs to come to the skilled nursing facility for continued treatment that they've been correctly assigned to that skilled nursing facility inpatient level of care, as opposed to only needing outpatient services. So again, the initial one is just saying, yes, this person needs to be here, needs this kinds of service, and that they're correctly assigned to a Part A skilled nursing facility level of care. On most of the forms that we see, there is a general statement for the physician or non-physician practitioner to sign for that initial certification that simply says something to the fact that they're certifying the SNF services to be given on an inpatient basis due to the need for SNF care on a continued basis for any of the conditions for which he or she was receiving inpatient hospital services, you know, prior to the transfer. As we move on, let's talk about the recertification and how recertifications are different than the initial certification. First, the recertification's purpose is to support why the beneficiary has a continued need for the inpatient SNF service. But just saying that the services are doesn't tell us what the need is. So the recertification must contain adequate written information on the reasoning why. So if it says PT for XYZ, nursing for XYZ services, you know, et cetera, then that gives us more information on what the need is for. So we see lots of certifications that are recertifications that just say PTOT nursing. Well, that doesn't tell us what they need PTOT or nursing services for. Also included in the recertification, there needs to be an estimate of the amount of time that the patient or the beneficiary is going to need continued care in the inpatient SNF. We know that this is just an estimate based on, you know, the physician or non-physician practitioner's judgment and the patient's response to already any medical or rehabilitative treatments up to this point. So again, it's just a guess, but the regulations do say you need to include an estimate of the amount of time the patient is going to need skilled nursing facility services. The regulations also say we need to see what the plan is for the patients after their Part A service is complete. Is it to go home? Is it to stay in a facility, going to a family member's home, home health, et cetera? So there is additional information, if there's additional information that's contained in the medical record to support this, the physician or non-physician practitioner can note where this information was obtained from. So for instance, continued care based on agreement with the PT and OT plans of care. All right, as we move on, let's talk about timing. Up to this point, we discussed why certifications and recertifications are necessary. We discussed that they can be signed by the physician or non-physician practitioner that has direct knowledge of the case. And we discussed what type of info needs to be contained in each. So now let's talk about the timing and when these things need to be done. The when is important information to make sure you have a clear understanding of, because as we will see when we review some actual documentation in the documentation section, failure to adhere to the correct timing of the SNF certification and recertifications may result in disruption of coverage, which could ultimately impact your Medicare reimbursement. The initial certification is due upon admission or as soon thereafter as is reasonable and practicable, which that's the way the regulations are written. But what does that mean? It means get it as soon as possible, but at a minimum, on or before the recertification, the first recertification is due. The initial and the 14 can be done on the same day. It's not ideal, but it is allowable. Leads me to the first recertification, which is the 14-day, which the regulations say must be completed no later than the 14th day. Remember, day one is day of admission. Now remember, as I discussed before, recertification must contain that information about why the continued stay in the inpatient SNF is reasonable and necessary, as well as the estimated time to remain in the facility and any plans for post-SNF care. So your next recertification, and this is important, your next recertification after the 14-day is due at an interval not to exceed 30 days from the date that the last recertification was signed. For example, if a patient was admitted on May 1st of 2025, the 14-day would be required by May 14th. If the physician or MPP actually signed on 5/14, then the next recertification would be required by 6/13. So that's 30 days from the date it was signed. However, if that physician or MPP signed the 14-day on May 10th, then the next recertification would be due on 6/9. If you utilize a certification recertification form that also has reminder dates that you can put in on the left side, I strongly encourage you not to append all the reminder dates based on the day of admission. That could throw your physician or MPP out of compliance with recertification. If you are out of compliance with certification and recertifications, and we happen to review your documentation, we could ultimately not pay you for every day that you are found to be out of compliance. We're going to look at an example of this coming up later, but just know that we could redo the RUG category. We could eliminate those days based on the fact that you have no proof that during those days that your patient was under the care of a physician. And we'll talk about that in a little bit as well. Okay, so I've told you about the rules and what could happen if you don't follow the rules, but sometimes there's exceptions to the rules as well. For skilled nursing facility services, there is a provision to the rules for delayed certifications and recertification. It can be used when there's an accidental or an isolated oversight or lapse by the physician or non-physician practitioner. Sometimes things happen. The physician didn't see the request. The physician was on vacation at the time it was due. There was a computer issue and the request didn't ultimately go through timely, etc. If that happens, then there is a chance to redeem yourself. The physician or non-physician practitioner can write a delayed certification or recertification. However, besides saying that it's being certified or recertified and meeting all those requirements, the physician has to explain the reason for the delay and attest to the fact that the beneficiary was indeed under their care during those dates of service that were missed. If there's any relevant information that the facility would need to provide to help support that delay, it would be beneficial as well. By additional information, I mean proof that the request was sent. Like if you have email confirmation or mail confirmation, etc. If there's information in the physician progress note that shows the physician was still actively involved in the care, we just had an oversight on signing the certification, then send that information as well. Any documentation that helps support that recertification that was noted somewhere else in the chart, like a progress note, is going to be beneficial if you run into that instance. All right, so this leads us to some examples of what we've seen for certification and recertification that I believe would be helpful for everyone to see. So let's move on and talk about these examples. So on your screen, and if you're following along in the handout, you'll have example 1. This is a certification and recertification for a patient that was readmitted to the SNF, and they noted that information up here. The admit date is 1/18/2024. And the initial certification was signed on that date. So it was signed the date of admission. The physician did not sign on the sheet, but we have that we have information in the transfer orders that the physician gave certification. This is allowable for it not to be contained there, and this is very nice that they let us know where this information was so we could go back and make sure that all the information was there. All right. So again, doesn't need to be on any specific form, and it doesn't need to be contained on this form, but it needs to be somewhere. Would it be helpful to see it all on this page? Yeah, but it was in a spot that was easy to find, especially since we were directed to it. Now, the first recertification is your 14-day. So it's due by the 14th day of this person's stay. Here is where it's okay to set that first reminder based on their admission. So the first reminder would, you could set it for 14 days after the admission date, because that's a hard, fast one. So that is just fine. So this recertification was completed in a timely manner. The certification statement here describes not only why they went to the hospital, but also gives us information about what they were being treated for prior. So this includes PT, OT services for a closed fracture of the right tibia, that the weight bearing is increasing. They list an estimated amount of time for skilled nursing facilities, and post-op or post-skilled nursing facility, they're probably going to stay in the long-term care. So it was signed and dated. I just redact all this information out, but it was signed and dated. And all in all, this is a good example of a certification and a first recertification. So moving on to example 2. So this form's a little different than the one we looked at previously. First at the top, you can see the admit date for this person. And it's kind of hard to see. I know it's a little bit blurry, but it's 3/16/2023. This certification was signed on 5/3/2023. So keep that in mind when we need to determine if this was timely. We have to look at all other recertifications and dates to make sure. So this person or this facility gives us the admit information, and then we're going to need to go through all the recertifications they submitted to us to make sure this one was done timely, as well as all of the other ones too. So each of their recertifications came on a completely separate sheet of paper. All right, we can't assume when doing medical review, so we have to go back through the documentation and find all that info. If it was not present, it would be difficult to say they are compliant with the timeliness, if that would be all we have. So again, we can't assume, but we're going to move on. In this form, they fill in the type of continued care that is necessary for this patient. So we know this person is having some skilled rehabilitative services. All right, a few things I want to point out on this one. Under the OT, so it's marked 5 times a week for 30 weeks for a humerus fracture. That's about 7.5 months. Could this be a typo? Probably, but again, we can't assume. Since I looked at this chart, I know at this certification period, they added in speech language pathology services into this beneficiary's care. However, I want you to pay attention to what they are attesting to the patient needs SLP services for. So over here, where they give the explanation, it says displaced fracture of the upper end of the left humerus, subsequent encounter with routine healing, and then cognitive communication. Cognitive communication is probably the reasoning for the SLP services. However, that not been marked in there and they just say they're going to provide speech language for displaced humerus fracture, it's probably not going to fly. We need more information about what that patient needs speech language pathology services for. All right, so this is form-wise an okay example form to use as long as it would contain all the information. If we had information about what that person, you know, like in their plans for post-SNF care, we know this person needs probably home health. We know additional days are probably around 30. You know, had we had better information here, it would probably be generally good, you know, a good form to use. All right, we're gonna move on and talk about example 3. And this is a certification, recertification statement. And the reasoning I really wanted to bring this example in is because we know the admit date to be 10/13/23, but this is just really illegible. Possibly be 12/17/23 that they sign the certification, but it's a good example of bad handwriting. And in the event that we get something like this and we can't read it, we do not have to pay you for your services. Even if I was right in my guess of 12/17/23, that's way beyond the time frame for a regular certification, that as soon as reasonable and practicable, but before the 14th day. This would be way over, and we would need to see a delayed certification statement sent in with this one. All right, example 4. Now, this is an example of an attestation statement for delayed certification and recertification. Things I'm going to point out on this: they identify the patient, they identify the dates of service that were in the oversight, that the patient was under the care of the physician during that time. Even though this is like a standard type form, they did make it specific to this patient by eliminating the OT and speech language pathology services, and that it was for PT. They noted that it was a clinical oversight by the physician. They have a signature and they have a date. So all in all, this is good. Now, do we see these very often? The answer is no. We need to see things like this more often if your physician has some, or non-physician practitioner has some sort of delay or oversight for whatever the case may be, and the certification or recertifications were not done timely. So these are rare, but these are necessary. All right, moving on to example number 5. In this case, in this documentation, we have a patient that was admitted to the skilled nursing facility on 6/23/23. The reminder due dates populated in for the 14th day on 7/6/23. The physician signed on 7/5/23. Therefore, the next reminder would need to be 30 days from 7/5. Again, not based on the admission date, but this should be 30 days from 7/5. In this case, this provider, they have two things that are going on. They actually set this reminder date early at 8/2 instead of 8/5. Also, in this case, the beneficiary actually discharged before this next recertification was due. But I wanted to bring this back up as an example of how setting the reminder date off of that admission date could potentially jeopardize the physician not signing on time and the patient being considered not under the care of a physician for a period of time, you know, during those dates of service. So this is an example I want to point out of what happens and what it may look like when the physician signs, you know, when those are based on reminder dates. The admit date for this one is 10/23. The certification and first recertification, they were both signed on 10/23. That's allowable. We discussed that before. We know that that 14-day needed to be done by 11/5. So they put in the date appropriately. However, your 30 days then for recertification needs to be based on 10/23, which would be 11/22, which should have been the date that was populated in here. Luckily for this facility, this physician signed on 11/22. This physician or non-physician practitioner. Luckily, they signed on 11/22. Had they waited and not signed until the reminder due date, this facility would have been 13 days out of compliance with that physician signature or non-physician practitioner signature. In that event, you would have denied 13 days of service from this claim. Could an attestation statement be submitted? You know, if we reviewed this and denied it and you go to appeal, could you submit an attestation from that physician or non-physician practitioner to say, yeah, they were under my care, this was accidental oversight, we screwed up because, you know, we screwed up our reminder dates and, you know, explained it, but yes, they were indeed under my care? Yeah, you would probably, if all things else in the claim were medically reasonable and necessary, you could probably get it overturned. But, you know, this is a great example of how just populating things incorrectly could really throw you out of compliance and how we could have not paid for 13 days. The last thing on this I want to note is this signature needs to be legible. The event that it's not legible and it's something like this, I couldn't even sanitize all these hoops and loops out, but they're not even legible. We don't even know what it says. We don't know if it was MD, a DO, an MPP, you know, et cetera. So in this case, if signatures look something like this, scribbled all over, there needs to be some sort of signature sheet that is submitted with your documentation. One of those sheets that say, here's what the handwritten signature looks like, and that comes after what the type signature is, and here's what the initials look like, et cetera. So that would need to be submitted as well. And then example 7, this is our final example. In this example, I want to point out a few things. First, the date of the initial certification is very hard to read because it's typed in underneath where this says date. However, if I zoom in on it, I can actually find out it says 11/12 of 2023. So the admit date listed is 10/25/2023. So this one, you know, was signed on 11/12/2023. And that's even beyond the 14-day for the first recertification that it would be due. Then the first recertification, the 14-day, was signed on 11/15/2023. So both of these are well beyond the 14-day in this case. So we would look into this chart for a delayed certification statement. We must verify that that patient was under the care of a physician and that the treatments the patient was getting were ordered and directed by a physician. So there is things like an estimated length of stay of 30 days in this case. However, there's no plans, there's nothing marked for where they felt that this patient was going to go post-skilled nursing facility care. We don't really have a good reasoning for continued care, gait training, lower extremity strengthening, return to prior level of functioning with walker. We don't know who they're directing to provide this. Is this, I mean, one would think this would be PT services, but OT can work on gait training as well. So we don't know what cares, you know, they're certifying that this person continues to need in this case. So in my opinion, this reasoning statement lacks some information. Will we look at the rest of the chart to see if that information is contained? You bet we will. All right, which takes us to the end of our formal presentation and really to the end of our time. But there was one pre-submitted question that I want to address before we conclude. And that pre-submitted question came in and said, is a cert or recert needed for a resident who transfers back to a hospital after only being gone for 2 days from the skilled nursing facility? So really, to answer this question would be dependent on why the patient left the skilled nursing facility and the status of the hospitalization. So I can't answer for certain without knowing that. But if that patient left the skilled nursing facility and was admitted to a PPS hospital as an inpatient, so a Part A stay at a PPS hospital, then that constitutes a forced discharge from the skilled nursing facility, because a patient can't be in 2 different Part A facilities at the same time. Therefore, the readmission date would start the counting again. The 14-day would be due 14 days from that readmission date for that beneficiary. All right, so I just looked over and I don't see any additional questions and answers. So I'm going to finish up with our last slide. We want to hear from you. We're committed to making changes to improve your educational experience. And based on feedback that we have been receiving, we've been making some changes to our educational events. We have started to add chapters into our YouTube videos. So when you watch encores or any other educational YouTube events that we have developed for education, you can skip to the things that you feel are most important. I encourage you to listen to the whole thing, but if you just wanted to go back and listen to something on documentation, then there are chapters built in now and you can do that. We've also added some training indicators to our live events. The training indicators give you insight to who these events are relative to. They'll say something like CLIN, which means clinical, BILL, which means billing. Those indicators, a list of those indicators is also available from our training page as well. So we list them and we also list a list of what they mean. In a few minutes, you're going to receive an email, and we encourage you not to delete that email. That email is also going to provide contact hours for you if you were to need that for continuing education. It also has a link to the survey if you choose to wait and take that survey from from that email. Follow-up questions. If you think of anything and you didn't think to ask it during this live event, you still have time. You can go ahead and email that question to me. Send it to this email address listed here on the slide, which is wps.gha.education@wpsic.com. And if you are following along in the slide deck, you can simply click on that, and again, that'll populate an email for you. Go ahead and send those in the next 7 days. If your question is regarding billing or something claim specific, I'm sorry, but I can't answer that. I don't have access to those claim systems. I cannot look up claims. Nobody in provider outreach does. You're going to have to take those questions to customer service, and they'll be able to pull that up and look at it for you. As I said a couple of times, we value your opinion, and we want to hear from you on how we did on this event. So we value your feedback. Jennifer placed a link in the chat that's going to take you to a survey that you can provide feedback about this event. The nice part is you can also provide feedback on what else you need in the future. What additional type of skilled nursing facility education do you want me to bring to you? What do you think would be most helpful in doing your jobs? So again, it gives you the opportunity to tell me what you liked, what you didn't like about this event, and what else you need in the future. Now, I do encourage you, be sure to read those responses carefully and complete it all the way to the end, as sometimes the ranking order does seem to change in that CMS survey during that course. And then finally, I want to thank you. On behalf of myself and Jennifer, as well as Medical Review, we want to thank you for your participation in today's event. This concludes our webinar, and you can now disconnect.